One of the things that I find really important, and especially with new board members, is reminding them why myself as a compliance officer is reporting to them, right? First and foremost, as a board member, regardless of whatever board you're sitting on, you have a fiduciary duty to act on behalf of the organization. And there's three specific duties which we'll touch upon, and I'm sure all of you already know them: duty of care, duty of loyalty, and duty of obedience. And as a board member, without knowing what those responsibilities are, it makes it really hard for you to be effective as a board member. The other really important element by which I am responsible to notify our board is making sure any legal, regulatory, any standard, any other relevant pieces of information is shared with them at our board meetings. The one thing that I always try and have enough information to the board so that, one, you get questions, right? You really want the board to be engaged, and you want to give them an opportunity to digest the information and be there to ask questions about the information that you shared. You, as the compliance professional, are the expert on what you're providing, but you want to be able to present it in such a way that the board understands what you're presenting to them, understands what their role is, right? And having an engaged board means that they're going to think about things that you may not have thought about, and what's the impact to the community? What's the impact to other patients in what you're saying? So I think having the opportunity to provide the information in such a way that prompts them with questions is really, really important. And I don't know, Patty, if you have anything to add.
Just to expound on what you've said, healthcare organization board members really must understand the regulatory risk. Healthcare is so highly regulated. We need to understand the regulatory risk, the function of the organization's compliance program, and then the flow of reporting of potential issues. And really, ultimately, the compliance efforts are necessary to protect patients and to protect public funds. So looking at the elements of board oversight, Deb mentioned, really the most important to me is the process of asking the right questions. And in order to ask the right questions, you have to have the right information. So the education is critical regarding the federal and state regulations we must adhere to, accreditation requirements, internal standards and policies. So there's a lot to be aware of and on top of so that we can ask the right questions when the information is offered. And then we have to ensure that there are internal controls for monitoring whether or not we do comply with the applicable statutes and requirements. And we also want to ensure that the organization is modeling its compliance program with best practices of like organizations. I mean, we're not a huge organization, we're not a tiny organization, but we should just compare ourselves to like organizations for best practice. Then I would just add, you'd mentioned that Deb is an attorney. It's great to have staff with that level of education and understanding, and with the compliance expertise she has to assist us in really trying to identify risk areas and provide insight into those best practices. And especially for those board members that do not have a healthcare background, there's a lot of education required there.